Hi you guys, and welcome back to the channel. If this is your first time seeing me, then hello. My name is London. I am a labor and delivery nurse and have been for many years now. And today we are going to be talking about what to do if your water breaks. Let's get straight into it. So, what to do if your water breaks? Number one, you want to make sure that you pay attention to the time in which your water has broken. This is going to be very important when you go into the hospital because we look at how long you have been ruptured, and that time is going to be very important in the event of any complications, any infection with you or the baby. We're going to want to know what time your water broke. So that is number one. Number two, you want to pay attention to the color of the water when your water breaks. You want to know particularly if the color is green. If the color is green, then that means that the baby has pooped inside, which we call it meconium stained fluid, and you will want to make sure you let your healthcare provider know if that is to happen. If the color is not green and it is clear or it is pink, clear just means that what we want, it's clear. If it's pink, there may mean there's a little bit of blood and amniotic fluid mixing, and those two are totally okay. If there's too much blood, then that is also something, like if you have very bloody fluid, you definitely want to also let your healthcare provider know about that, because that could be something to be concerned about. Number three, you want to make sure that the baby is still moving around after your water has broken. When we are in the hospital, when either we break your water or if your water breaks, we immediately put you on the fetal heart rate monitor just to make sure that the baby is doing okay. Once the water has broken, it is a change in the baby's environment, and you want to make sure that the baby is tolerating that change. So you want to make sure that the baby is still moving around after your water has broken. If you have decreased fetal movement, then you definitely want to let your healthcare provider know, or just go ahead and head on into the hospital if you feel like the baby is not moving as much as the baby was prior to your water breaking. Number four, when your water breaks, you definitely want to know your GBS status. GBS is a bacteria that can lie in between the vagina and rectum. It is a test that we do during pregnancy to test if you are positive or negative for GBS. If you are positive for GBS and your water breaks, you definitely want to go ahead and head on into the hospital, because you do have to be treated with antibiotics when you are GBS positive. And typically we treat you with penicillin. If you cannot have penicillin because of an allergy, then we would treat you with a different antibiotics, but you do need to be treated when you are GBS positive. Number five, you want to make sure you measure your contractions when your water breaks. So sometimes the water can break before the body is actually ready to go into labor, and sometimes the water can break as a sign that labor is beginning. Both of these things can happen, and you really want to measure and see what is actually happening. When you have a premature rupture of membranes, that just basically means that your water has broken probably before the body is ready to go into labor. So you want to make sure you understand which one is happening so you can correlate that to your healthcare provider when you call in and let them know that your water has broken. This is also going to be important for setting the expectation of time frame and how long it may take or may not take for you to actually go into labor and actually get delivered. Because remember, the longer you're ruptured, the higher risk there is for something we call chorioamnitis, which is an infection of the uterus. So once your water is broken, we do want to try to deliver as soon as possible. We don't really want to wait days and days and days on end while your water is broken, because it puts you at risk and also the baby at risk for an infection. Number six, if you are not full term and your water breaks, this is called premature rupture of membranes, and you definitely want to head into the hospital if this happens, because your water should not be breaking if you are not full term. We really don't want you going into labor preterm. So if you are going into labor, meaning your water has broken, then that is definitely a reason to head on into the hospital and get checked out and see what's going on. And usually, if that is to happen, you will be staying in the hospital at least for observation to see if somehow the bag seals up, or if you're constantly continuously going into labor, then you will be there for delivery. And if you feel like or suspect that your water has broken but you are unsure, so if that is to happen, you want to make sure that you put on some underwear, and you also put a pad into your underwear to really see if the water is leaking onto the pad. If your water has broken and it is actually broken, the water will leak onto that pad, and you typically will leak up until you deliver. There are very few cases where the water bag will seal itself, like we talked about with premature rupture of membranes. But if you are full term and your water breaks, you will know, because you will continuously leak up until delivery. If you have found this video valuable, then definitely go ahead and follow the channel for more content like this, and also like this video so that it goes out to more mamas, so we can help educate as many mamas as we possibly can. And I will see you guys next week in another video discussing all things labor to help you guys make informed decisions for you and your babies. Until next time, bye.